Recording in progress.
Hey everybody, and welcome to Ben and Nate's Questions That We Ask Massage Therapists on the Internet. I am one half of your host, Nate Fay, and my good friend and I are here to do what we do best, which is ask questions on the Internet, have you answer them. We take your answers and we dissect them, we put them together, we have some fun, we get serious. And Ben, what say you?
We built this big following on our Facebook page called Ben and Nate's Questions We Ask Massage Therapists on the Internet. That's where you guys get to interact with us, and that's how we get the show made. We have such a great time putting this show together. Like we've said in the past, it wouldn't matter if no one was listening because we just get together and do what we do. And just, it's kind of like water cooler talk. We're sitting around the water cooler at work, but we're distanced from each other. But we're just talking about the industry.
And Ben, not only are people listening, but according to our analytics, 2% of our listeners are in Japan.
Yeah, do you know any Japanese, by the way?
I don't.
Okay.
Moshi? Is that Japanese? I don't know.
Well, I don't know any Japanese either, so
Well,
hopefully
no.
you didn't say something to ruin that 2%
Right.
that's listening.
Well, to our Japanese listeners, please email us and let us know how we can greet you.
Yes. Hi.
Hi.
That sounds, I don't know if that's Japanese or not, but we're going with it. Oh man. So what's new in the world of Nate?
Well, I know we're going to talk about our question, and I'm pretty excited. I'm excited this week because we actually got a lot of responses, and we got a celebrity response, which we'll talk about shortly.
We're
And
gonna keep you in suspense. We won't tell you who that celebrity is just yet.
But all in all, things have been good. It's summertime, and my favorite time of year. It's approximately 8:53 p.m. and the sun is still setting in the distance. You can kind of see it's still kind of light out, and I love that. How about you?
You know, interesting. I've been chasing the sun for the last 4 years in my photography journey, and in the last couple years, I've been paying attention to daylight hours. So when the sun rises, when the sun sets, when the moon comes out. And so we just had the longest daylight hours of the year the other day, which is the official start of summer solstice, I think they call it.
Yep.
And so the days are starting to get shorter now. But it's interesting. So I don't know if I can explain this correctly, but the sun continues to set later as the sun rises later instead of rising earlier. So you would expect when the days get longer, those two separate from one another. But it's actually the opposite. The sun rises at a later, faster rate than the sun sets. Mm-hmm. So it's kind of a shift. Even though days are getting shorter, right? The way that and it's not much. It's like a couple minutes, but I find that fascinating, and I don't know why it does that. And I've made the decision that I don't know enough about maths and the way the Earth, does its thing. I don't know enough about any of that I don't care. I just know that it does that.
Ben, we just gave a lot of education for free. So not only do we answer questions about massage therapy, but apparently you could work in a planetarium.
I think it's I got all my information from timeanddate.com. So there you go.
So what do we got cooking? What do you want to talk about this week? We have a question.
We do have a question that we asked on our Facebook page. We got so we're like I said earlier, we're putting together a pretty good following. And so we're putting out questions, and people are noticing. They're noticing us. And it's only taken 2-3 years that people started noticing us, but that's fine. I'm patient. I can wait another 2-3 years. I don't need everyone to notice us, just the people that we like. But anyway, our question reads, what is a common clinical belief or rule in the industry that you used to follow religiously, but now completely disagree with based on your experience? So let me read that again. What is a common clinical belief or rule in the industry that you used to follow religiously, but now completely disagree with based on your experience? And so after reading that question, this is a good question. I'm not exactly sure where it came from, but I know it came from the mind of Nate. And so I want to get your hot take. What's your 20, 30-second hot take on this question?
Well, it was a long time ago we talked about like massage myths, right? So that was like drink water after your session. We're releasing toxins.
Ejecting babies.
Injecting, yes, we're ejecting babies.
Ejecting, yes.
Not injecting,
No,
ejecting.
yes.
Lactic acid, right? Those were all massage myths. So this is like a little bit different. So this question is rules. Maybe a rule is you have to do a technique on both sides of the body. Maybe a rule, and you talk about ethics a lot. Maybe a rule is you shouldn't become friends with your client. Or maybe a rule is, that whole that you always have to work towards the heart or proximal to distal or whatever it is. And that could kind of fall into like the myth category as well. So that's kind of what I was like thinking about. Or maybe it's a rule that we have to work on people for 60 minutes. So those are some of the things that went through my head when thinking about writing this question. And we got a lot of great responses, and I know we're going to dive into those. But let's talk about some rules, Ben. What are some rules that we were taught that we don't really follow anymore?
Well, let me tell you, I spent probably a good part of 8 or 10 years trying to find those rules, right? And it's not that, I don't know. I'm going to give you my quick hot take.
Okay.
Now that I think about it. You chase down these rules to become a better therapist. But what happens is what we understand changes over time. So what we learned, or what I learned back, 23 years ago is different now. And does it mean that rule back then was bad? I feel like it was the best I could do with what I knew at the time.
Yeah.
But if you latch onto that and don't allow yourself to evolve and change and stick with, and I still hear people saying, make sure you drink plenty of water to flush out all the toxins. I still hear people saying that, and they're stuck in that same mindset of not evolving with new information.
Yeah.
So
yeah.
that's my quick hot take on things. So yeah, back to what you were talking about, some of the rules. What are some of the rules that you came across?
Well, and I want to kind of elaborate on your point too, because I think whenever we do this show, it's important to say that exactly what you said, right? Things change, right? These aren't, when we talk about this stuff, if you're listening, if you're a newer therapist, if you're an older therapist, this doesn't mean what you're doing is wrong per se. This is exactly what you said. These are things that we've just changed over the years. And Ben, you've been doing this for 22 or 23 years now. I've been doing this for 20 years now. And I could probably tell you that I still love evolving in my practice for a lot of reasons, because it keeps it fresh for me and keeps me on my toes. But what rules? I think one rule that I stuck with for a long time is that like my session had to be 60 minutes. It had to be an hour session. This was something ingrained since day one in massage school. And we talk about changing things maybe every couple years, but this whole hour thing with me personally stuck around for a long time. So the general public has it ingrained in their head that the session should be an hour, that they're paying for the hour.
Right.
And I thought about that for a long time, and it's really not until the last few years that I've changed that, and I've changed my language that, listen, good therapy doesn't have to have a time limit or a time maximum. That good therapy can take place in 30 minutes. Good therapy can take place in 45 minutes. Good therapy can be 60 minutes, whatever you choose it to be. But 60 minutes for me just wasn't what I was into anymore.
Yeah, in my head, I'm hearing, I've never used this wording, but it's one of my pet peeves. When you walk in and talk to the massage therapist and they say, okay, so it looks like we're going to do a 60-minute full body massage today. Is that right?
Yeah. Is that
Like
right?
that is like fingernails on a chalkboard to me. It's rough. It makes me cringe when I hear 60-minute full body massage. What's so magical about 60 minutes anyway?
Yeah, what's magical about it? And again, most of the public is just so well groomed for that time frame. So for me personally, it didn't take a long time, because as I always say, you build it one client at a time, and that's just the way you do it. So as new clients came in, and although reputation, right? Like your reputation and many of our listeners, your reputation, if people are coming in to get, fixed up for low back pain, I don't think they necessarily care as long as they feel better. But I do specify how long they can plan to spend in my therapy room. But I always emphasize it's not all treatment time. But for your calendar, you can plan about 45 minutes.
But in reality, it is all treatment. As soon as they walk in the office, it's treatment, right?
100%. Yeah.
How they perceive the office, how you talk to them. I mean, it's all treatment.
Yeah.
But people have this idea that it has to be, if you're not using your hands on them, it's not actual time.
Right. And I also fill in those cracks. I say, we're going to, there is going to be a lot of hands-on time. And I do say a bulk of my sessions will be hands-on time, but we'll also talk. We'll have education. We'll work on some movement routines together. And so again, at the end of the day, as long as it's clarified, it's clarified. And I've got that one client that's been seeing me for 19 years who still gets an hour because that's all she's ever going to know.
Yeah.
And why change an old dog?
Yeah. Don't change the expectations on her. I'm going to put in a quick plug for our friend Drew Friedman and his book, The Tao of Clinical Touch. I just went through that book and loved it. It's a great read. It's pretty short read, but it's deep. It's one of those that I have to keep going back to because it's profound. It's so deep.
Drew did a great job with that. I've got a chance to read a chunk of it, and kind of like you, I want to go back with it. And beautiful job on his marketing, by the way. He did it. Smart.
Yeah, he's a good dude. I like him.
Yeah.
We like him.
Yeah, absolutely.
Yeah.
Okay, so that's a rule. 60 minutes, the 60-minute rule.
Let me throw out another rule that I learned, and it's kind of 2 in 1, but I'm going to say, I kind of learned no pain, no gain type of an attitude. So the idea was we are going to destroy the knots because the knots are what's causing your issues in the tissues. And if we don't hammer on them with a big elbow and just beat the crap out of them, your knots are never going to go away and your pain is never going to go away. Right. So that was, that was pretty much straight out of school that I learned that.
Yeah.
Or during school even.
And that went on for a long time. That was a hard fought rule for a long time that it had to hurt to work. Yeah. More is better, more is more.
Yeah. And it wasn't about, it was always how much can you handle, and even beyond that, we're going to make you tap out.
Yeah. 100%.
And I'm not proud of that, but that was, that was the thinking at the time. And I even remember I left some bruises on somebody one time, and I that's when I was like, okay, this is too much. I need to rethink my approach.
Right.
Bruises are not what I want people walking around like, oh yeah, I got these bruises from Ben Stone Massage Therapy. Like, is that my business card that I want? I don't know.
I use talk about this in a lot of my lectures, and so when I talk about low back pain in my seminars, and I always think it's important to hit on common conditions people might present with and how to spot them. So I use this conversation in my classes, and somebody comes in with low back pain. And so one of the questions that I like to ask them is if they ever had any sort of therapy before. And if the answer is yes, my next question is, how do you feel after your session? And one of my clues is if somebody says, I could barely get off the therapist's table afterwards. And just to jump ahead really quick, so I always say that could be an indication of like a spondylolisthesis, possibly, right? So it's just something to look for. And of course, but the play that I use is just to kind of make it funny because it's real. Is okay. Have you ever had massage before? Yes. How'd you do getting off the therapist table? Oh man, it was terrible. Or no, man, I could barely move. I could barely get off their table. It was the best thing ever. Right? Because people perceive that they got so worked over and could barely move that that's what was supposed to happen. And it still exists to this day.
That's interesting. We create an expectation that you should hurt and that hurt is going to make you feel better. Yeah. And I mean, I know we're evolving away from that, but that's the way it was back then. And that's interesting.
Yeah. So there you have it.
Wow.
What about, go ahead.
I was going to ask if you wanted to bring up some more that weren't mentioned in our Facebook page, or if you want to pick a couple, because I know we had some good ones in our Facebook page.
We had a lot of good ones
that are probably some that we would come up with on our own. So maybe we could, bring up some of those if you wanted to.
Oh, okay. I actually like these two go hand in hand. So I want to pick some of our listeners because these are some that I would have brought up.
Yeah.
But I like this. That you have to work on both, like both sides of the body. So what I do on the right arm, I should do on the left arm. And what I do on the whatever, I should do on the opposite side. And that's interesting, right?
You don't want someone to walk away unbalanced, right? Because they're just going to have to make a bunch of left turns in order to get out of the office.
Yeah.
If you don't work on them balanced.
And this can be a bigger conversation, which I'm not going to derail us, but pain is so complicated, right? Pain is multifactorial. It's whatever, but the aspect of pain that we look for, somebody might have pain. Let's say like they're feeling it in their right low back, right side of their lumbar spine, but maybe we have to work on the left side. And shockingly, people say, that's weird when you do that on the right side, even though that's where the pain is. I don't feel that, but when you touch my left side, it feels really sore or tender. Or the example of like neurodynamic techniques is a big one. If I've got carpal tunnel syndrome on my right hand, why would you go through neurodynamic techniques on my left hand or my left side? So it's interesting.
Yeah.
Have you had clients, Ben, or jaw work? Jaw work's another one. If you're assessing like jaw movement, why would you do, the same thing on both sides? Someone's going to walk out of there not chewing their steak for the next few days after your session. Do you have people say to you, "Hey, can you do that on the other side just so I feel more balanced?"
I'm sure I have. But I think it comes down to what we've talked about in the past, and that's creating the expectations and explaining why we're doing what we're doing and what they can expect from what we're doing. And I think that helps clear up confusions about balancing left and right work.
So if you're saying if we get ahead of it, then we avoid the question.
Right.
Yeah. Yeah. And once in a blue moon, I guess I probably drop the ball and don't get ahead of it. And and I know that I've dropped the ball when somebody actually asks me, "How come you didn't do that on the left side? What you did on the right side?" But it's a good education moment. And
Yeah.
100% of the time, people are going to say that makes sense.
And normally what happens is I start working on one side and they tell me, it was the other side that hurts, right?
Yeah.
Like, oh, yeah. So I just testing to make sure you were
Yeah.
paying attention.
Yeah. Yeah. Sometimes if I forget, I'm like, "Can you point to that spot where you're feeling it?"
That's a sneaky one. I
Yeah,
just
that's a
straight
good
up
one.
ask. I don't even mess around
Yeah.
anymore. What side was it again? I forgot.
Right. And once in a while, I like to throw in the joke, like, "Hey, it's a good thing I'm not doing amputations today." That was a classic one.
That's a good one.
And hand in hand with that, so don't let any part of their body touch any part of your body. And
Yes.
that's like a massage school one. And so for a long time, I'm like, in this sort of weird humpback whale position working on people. And of course, my whole body would hurt after those sessions.
Yes.
And so now it took me a long time again, right? That my table's a tool that I'm like right against that sucker so it can hold me up and leverage. And when I'm doing head and neck work, and sometimes I need as Eric Dalton used to say, my third arm, my abdomen,
Yeah.
to hold them up.
Because
So,
what's the thinking? If you were to touch somebody while they're in the pure relaxation bliss state, you might
right.
pull them out of that relax and just ruin the whole 60-minute
Yeah.
magic massage.
Yeah, it's so bizarre, but I mean, changing my attitude on that over the years has really saved how I feel at the end of the day.
Yeah, I think a lot of that goes down to intent too. If people know that you have a good intent, because there's things that happen to people,
Yeah,
trauma.
absolutely.
There could be an issue of trust, and if who knows if you can't see what that person is doing and you
Yeah,
feel something,
right.
that's yeah. Trust is a
But
big issue.
yeah, and that also goes to talking through that in the beginning,
Yeah,
and setting all those expectations, and especially at the first session. If I start somebody face down and I start with a technique, the first technique that I start with, I say to them, "Okay, you're going to feel my hand go here, you're going to feel my other hand go here, and take it from there."
yeah.
How about you, buddy? You pick go ahead and you pick one.
Well, that's a good question. We already talked about it a little bit, but somebody mentioned the deep tissue hoax, and I think that was kind of what we talked about a little bit.
Yep.
I did ask for a little bit more. I wanted to hear a little bit more about specifics of that, but it looks like we didn't get a reply on that. Oh, and we kind of mentioned a little bit earlier with the this is another one that goes back to those massage myths and massage in the first trimester of pregnancy. Because if we touch certain spots, we're going to eject the baby, and that wouldn't be good.
Right.
I like
Right.
that one. That was a good that's one we've talked about in the past, but I still like it.
I think things have gotten better though, Ben, because I feel like I don't get that question anymore. If I have a long time client that, then enters the great world of pregnancy, it's not even a thought in their head. And so I used to get asked that question, is it safe for you to work on me? I heard that it wasn't safe for you to work on me.
Right.
And I've talked people through it. And of course, the classic, man, if I could eject that baby, I'd be hired at the hospital.
Right. I wouldn't be working
Yeah.
here. I'd be
Wouldn't be
making
working here.
millions at the hospital.
Millions. Pew, pew. So, but luckily, I don't think that stuff comes up
Yeah.
like it used to. Are you in your practice, Ben? Do you get these questions from lay people coming in concerns like that?
Mm,
Not just with the pregnancy, but really with anything.
yeah, I do have people that come in and they want me to bring out the sledgehammer and work on the knots
Yeah.
because the knots are tight. I don't know,
Right.
and that's what I asked them. Like, what does tight mean? What does tight feel like? Well, it's just tight. I'm like, well, what can't you do? And I try to get them to think about what's actually going on versus just this word that is thrown around. It's tight.
Yeah.
It's tight muscles. It's knots. You just need to release them. It's like, let's get deeper into it. Yeah.
I did have somebody say to me yesterday, she's a longtime client, and I don't give away water after my sessions. I used to. I haven't done that in years. But I got this nice new office, so I figured I'm gonna get one of those like water like cooler things, the Poland Spring deals, and
Yeah.
it was like a rental fee and it was a delivery fee, but I thought, you know what? It's mindless. It's just there. They set it up for me once a month. I don't have to do anything with it. And unfortunately, it's not like I'm seeing 400 people a week. So the water consumption versus the amount of water jugs I had, it just wasn't making sense. And so it was short lived. It had a 4 month run in my office and I got rid of it. And interestingly enough, I don't tell people. I just like to see if they notice or not. And interestingly enough, I think like two people made a comment to me. And I had a woman yesterday say, "Oh, you got rid of your water machine." And she's like, are you gonna replace that or do something else? Because she says it's so important. She said, when I get massage at Massage Envy, I always get a bottle of water afterwards because I know it just helps with that toxin process. Now, this woman's 70 something years old and she's been a long time client. And, it's why am I gonna argue with her? Not argue, but why am I gonna get into it with her? I just said, oh, that's cool that they do that. I don't think I'm gonna get back to it just because of the volume of clientele I have. And,
Yeah.
you know,
Yeah. Sometimes after massage, I'm thirsty
right.
and water's nice, but I have water in my office, but I don't offer it to people. Sometimes they'll say, "Hey, do you have a water?" I'm like, "Yeah, I'll
Yeah,
grab you a water." But I don't
totally.
advertise like drink water. Like
Right.
everybody needs to drink water. It's just, and most people now they come in with their giant Stanley cups anyway.
Right. Right. Everyone's got fancy, fancy, fancy things now.
Yeah.
Although we could get water, you can market anything now. You can buy water bottles with your own label on it.
Yeah.
So we could have Ben and Nate's magical massage water.
Ooh,
Let's do it.
I like that.
Send it
Make
to the net.
Yes, we'll have AI help us out with marketing and creation of that. But hey, should we talk about our celebrity contributor?
Man, I was tickled. I was tickled. I'm always tickled the fact that anyone responds to our questions. And we actually had, by the way, this is fun to talk about. We actually had a bunch of people to comment. I saw a bunch of names on this that I normally don't see. So I thought that was awesome. And I was scrolling through our comments, and some of you might know him. He's out in upstate New York, and he is the king of voice and swallowing disorders in the world of manual therapy. And our very own Walt Fritz,
Yay.
who also penned an excellent book for manual therapists and speech and language pathologists.
Yeah, I have his book. I haven't been all the way through it yet, but I'm reading through it.
Yeah. So
So tell
there you have
tell
it.
tell the listeners what Walt Fritz wrote in and said. What was one of his beliefs or rules that he used to follow religiously, but now
Well,
disagrees with?
something that Walt talks about all the time, and I've learned a thing or two with a lot of his writings, and the dirty P word. It's a dirty word, and that word is posture. That posture is an objective tool to determine dysfunction.
So what
So
would be
yeah.
some reasons that someone would look at your posture and give you not necessarily a diagnosis, but some sort of assessment that what's bad about posture, or what's potentially bad about posture.
Yeah, what's potentially bad about posture? And people come in with this, people come to me and they say my posture sucks.
Yeah.
And that's tough too, because I want to validate how they feel, but I also want to tell them that, educate them a little bit about their posture really doesn't suck, and why their posture is doing a lot of good for them. Because if they stood up straight and their grandmothers told them to sit up straight, they might be in more pain. And I'll
balance
educate
that
them.
book on their head as they walked.
Yeah. So I'd like to give that education. And, certainly there was a long time that in our industry it was a standard to tell people, oh man, you look terrible. You're all hunched over. You look like shit. Right? You must not get body work.
Yeah, well, and like you said, people come in and they say, I know my posture is bad at my desk.
Yeah.
And therefore, I have headaches, or therefore my shoulders hurt. All those other reasons that poor posture at the desk supposedly causes.
Yeah. Yeah. And that's a big conversation, because again, I want to meet people where they're at. And I had a new client come in today. She goes, my posture is absolutely terrible. And sure, by the standard definition of what we might think about posture, yeah, it was pretty bad. Bad with, but I also explained to her that, kind of like Walt was saying, that this wasn't defining, it wasn't the whole enchilada.
Yeah, I went to see the lecture from Gil Headley when he talked about, dissecting the nerves, which was fascinating. Yeah. But he said something about, I'm going to paraphrase, but he said something about normal anatomy. So normal anatomy is made up from thousands of people, and you create an average of everyone. Therefore, no one is actually average. Everyone is part of making up the average, but no one is actually average. So you have some people's posture that don't fit the normal textbook posture. Mm-hmm. But does that mean it's bad or wrong or symptomatic? I don't know.
Right. It's tough.
Yeah.
But maybe it's a better conversation, to have with people, to maybe how they got there, why they're there. And we might not make you, stand taller, which is the picture they have in their mind, but maybe we'll make them feel better.
Yeah, and if we look on the positives instead of always the negatives, and say, what about what's going good with your posture, not what's bad about your posture, and have them think about, everything that is contributing to their wellness and not their dysfunction.
Yeah. And we don't realize as therapists, right? Saying something to somebody else, and it could trigger, like, it's a sort of like body dysmorphia, or trigger the feeling that there's a problem when there wasn't one before. I had somebody say to me a couple of years ago, one of my colleagues was like, oh man, you must not get a lot of body work. Look how you're walking. And I looked at him, I go, I feel totally fine. So I said, I'm not sure what that was about, and just kind of kept moving. It's like, whatever,
Yeah.
It's such a weird comment. But then, of course, in my head, I'm like, what the fuck's wrong with me?
Yeah, I think you're kind of referring to the nocebo effect.
Yeah, and it could totally happen, because then I was like, oh man, like, am I walking weird or something like that? Maybe I am, but I don't know.
Well, I like this comment that Walt shared, and it reminded me of, a lot of times the psoas gets blamed because we're sitting for long periods of time. The psoas somehow shortens because it's in a shortened position, so it holds on to that position, and so that can cause a little back pain. But then I don't know where I saw it, but somebody said, "Well, our our arms are bent too, so why are not the elbow flexors causing problems the same way, the hip flexors are causing problems?"
Oh.
And that made me think like, okay, if this mechanism is at play in one place, it should be in play at other places, and maybe not. I mean,
Um,
I think one of the things that we're learning is that we don't know very much, or at least I know I'm learning that.
well, and I think Walt's comment, which is a great comment, because that is a rule that we all followed. But if we look at the history of that, stuff that was starting to be put into print, in like the late 60s and early 70s, especially when Rolfing was coming along, and then eventually, like, different forms of myofascial release. And so things got put into print. And when things get put into print and are in a book that you can read and still buy to this day, and I'm going to hold this up to the camera. And this is a first edition Rolfing by Ida Rolf that somebody gave to me as a gift, which
Nice.
I thought was cool.
Yeah.
And while I'm not interested in becoming a Rolfer, I've been reading it. And this book, even though it's not truly written by Ida Rolf, um, interestingly enough, this book that was written a long time ago, you know, alludes to like that this stuff wasn't set in stone either. And but people might read it. If you read a book from 40 years ago and you're a new massage therapist, you might take that as gospel. And the guy that I love the most, Eric Dalton, I mean, he had stuff being put into print in the late night or in the early 90s from his studies in the 70s, because that stuff, persisted.
Yeah.
And
How often do textbooks get updated in certain schools?
well, yeah, and all of a sudden when it comes to time to update it 20 years later, people like Eric were towards the end of their career. So in the 90s, when he was saying that the coccyx is the seat of your soul, right, and had some of that language that feels a little outdated, and Eric knew it was outdated, but what are you going to do at that point?
Yeah.
So, and there's nothing wrong with that either, because, for me, I take a lot of that language and it still means something. We can still learn something from it.
Absolutely. We need to know where things originated from and how they got us to where we are.
Yeah.
I think that's helpful to know the history of where we were at and where we're going. And who knows where things are going to be in another, 10 years, 15 years.
And at the end of the day, and even though we talk about things change and words change, they really don't, They really do. Well, as I've gotten past some of this stuff, as I fell into the days of like, oh my God, everything I'm doing is a lie, it's like nothing really changed. It really didn't. So I've kind of gotten over that. But I think too, I just want to stay with this posture thing. This is becoming a posture podcast all of a sudden. But does anyone really like know the true definition of posture?
Well, I mean, isn't posture just how you are at that particular moment?
Yeah.
Because we've got these posture grids, right? And you throw somebody
Yeah.
up on in front of the posture grid.
Oh,
And so if we want to assess how they are standing at that moment, then we
yeah.
can assess that posture for that exact moment. But
Right.
what does posture mean if we can't function through a movement, through walking, through, any kind of movement? Like static posture is not really that great of a assessment tool.
Yeah, right. And so posture comes from it's a Latin derivative, and it basically means to place, or how the body is placed. So at the end of the day, if your place is hunched forward, rounded shoulders, head forward, that's what your body did. That's your place.
Yeah.
And I don't think that's a bad thing.
Well, I mean, if
So,
you're not having any problems with that posture. Maybe in the future you might start to have problems, but
Maybe, maybe.
and is it, I don't know. Like Walt said, is posture a tool to determine dysfunction?
Right. So, do you think it should be a tool?
I think it should play into the overall assessment, but I don't think it should be the tool to determine.
Right.
Yeah.
Like the main event.
Yeah.
Sure. Sure. But again, when people bring it up, we have to I believe we have to validate it.
Yeah, validate and educate, maybe start to,
Yeah.
start to allow them to open up their mind to possibilities of change and anything else
Right.
that might be helpful.
Yeah. So I think that's another one that could fall into the rules, right? The
Yeah.
rules of assessment. Check somebody's posture out.
Yeah.
So that's a rule that we can, you know, maybe we can agree to disagree with that. Not completely disagree, but change that a little bit based off of time.
Right.
Let me ask you this, buddy. So let's move on from that and let's go with one more. We got time for one more?
Let me check. We got time for one more.
All right.
The boss says yes, we have time for one more.
How about relationships? And I don't mean non-romantic.
Yeah.
Family, like we're family now.
I mean, this has come up frequently when I have to renew any type of licensure. The what do they refer to it as? I can't even remember now. Help me out here.
Ethics.
Yeah, the ethics, but they refer to like dual relationships,
Dual relationships, sure.
and that kind of thing.
It's so hard. I mean, I have families, complete families, and so many people come to see me. Like I've got mom, dad, brother, sister, wife's extended family, and it gets to the point where they're like, "You want to come over for Thanksgiving this year?" It happens, it just happens all the time. And I've got clients that are like, "Hey, we're gonna go see a live band this weekend. Do you want to come hang out?" And I'm up and down with it. I'll admit I am up and down with it. It's it could be a tricky situation, meaning how much of your real self do you want to show? But if it's all innocent and there's a group of people or whatever the case is, I mean, social media connects everybody now. So, of course, the age-old question, should you be friends with your clients on social media?
That's a good question. I actually I did an ethics class 5, 6, 8 years ago about that and about separating yourself or what you should do over social media. Should you put yourself out there? Should you separate and have a work presence and a personal presence and keep those separate and all that stuff? But I'm kind of with you. I'm a little torn. But here's my question to you: is if our goal is some kind of beneficial therapeutic outcome, could a personal relationship put that therapeutic outcome in jeopardy?
It could, yeah, it certainly could. One thing I will say based off that is one hard rule that I have is I won't mix business with business for that exact reason. So in other words, if you're my client and you're a real estate agent and I have to sell my house, I'm not going to use you. If you're an accountant, I'm not going to use you. And I've had people ask me if they can barter stuff with me, and I'm very blunt with them and I say, I appreciate that, but I'd rather just have, you pay me, I'll pay you kind of a thing.
Yeah.
And quite frankly, I'd gotten involved a long time ago, business with business, And if the other person does shitty business, it's hurt the therapeutic relationship.
Yeah, for sure. I think going back to what we've talked about in the past, if you are going to start any kind of relationship with a customer, client, those expectations need to be set forth pretty clearly. You got to have some pretty clear, expectations of how things are going to go.
Yeah. So I personally found the mixing business with business, I won't do it.
Yeah.
But the occasional, if there's an event, like a 4th of July event, and, there's going to be just, it's not just my clients, but a lot of other people there, I'll totally go.
Yeah.
And I'll do something like that. Or if it's like a local band's playing and a bunch of people are going to be there and my clients just so happen to be like, oh, we're going to be there, cool. We'll come by and like say hi and that sort of thing. Of course, my favorite is these people I see all the time, and then they see me out in public, and they're like, "Do I know you?" Because we're out of context, right?
It is. It's hard for me to recognize people.
Right.
Like I might recognize them, but I'm like, "Oh, what's their name?" But I mean, you come in my office, I know your name immediately.
Yeah. Can you take your shirt off for a minute? It's just,
that would be weird.
Can you put these gym shorts on?
Yeah. Oh, and I just remembered the other two that went with dual relationship. It is transference and countertransference. Those are the three things that are always in an ethics class when it comes around to having to renew some sort of license. I take those classes online and have to remind myself, okay, what does transference and countertransference mean, and why is it bad, and why,
blah 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 blah.
Yes.
Blah. Yeah. Right. Well, Ben, these were exciting. We had a lot of fun answers. I think this was a pretty cool conversation overall. So,
yeah. So how about we like to go in and talk about a big takeaway? Do you have anything that left an impression on you of what we talked about?
It's not so much. I always love everything we talked about, but I think one of the things that I like to think is that a lot of this stuff is just kind of going away. Just in general, and even the lay person is not coming in with these preconceived notions. So I am seeing a shift overall with a lot of these things and how therapy is done, and I think people are getting better overall at knowing how to set expectations, know how to have those conversations early on, so that really none of these things are become a big problem in the end.
Yeah.
Rules are meant to be broken.
Absolutely.
How about you?
Oh, my big takeaway is just thinking back on how things have evolved from what we used to think was important, and now based on experience and new findings, it's maybe not as important, and what's going to be the future of what do I believe in now that may change in the next 10 years? What might I disagree with in the future that I think is a rule now? So that'll be interesting. So in 10 years, we're going to come back and we're going to redo this episode with this exact question, and we're going to let you guys hear what's changed.
I was actually going to say we could probably do it in a year and find that it's a lot has changed.
Probably. I like the idea of 10 years because Nate and I will be 10 years older and 10 years wiser. So Nate,
excellent,
if people like this show, tell them how they can support what we're doing.
My top two ways to do it are answer our questions and listen to our show. And if you want to go the extra mile, throw a review on your favorite podcast platform.
We love reviews. Tell us what you like. Tell us what you don't like. Tell us what we can change in the future. So we want to hear from you. Go to Ben and Nate's Questions We Ask Massage Therapists on the Internet Facebook page. Interact with our questions, because without you guys, the show just isn't the same. We want your interactions. We want to know who you are, where you're from, what you're all about. Let us know. We'd love to hear it.
See you next time.
Thanks for listening.